Dental laboratories play a key role in modern dental care. Beyond technical fabrication, dental laboratory specialists contribute to treatment planning, material selection, and quality assurance, directly impacting clinical outcomes and patient satisfaction. Let's all welcome our guest, Amna Ashkanani, dental laboratory specialist, Al Farwaniya Specialty Dental Center. It's really a pleasure to have you, Miss Amna Ashkanani, and it's really a pleasure to have you in Good Morning Kuwait.
Thank you. Good morning too.
First of all, let's start with the broader question, which is how would you define the professional scope of and clinical responsibility of a dental laboratory specialist within the overall healthcare system?
Okay. Dental laboratory specialists and dental technicians play a significant role in dentistry. They are often behind the scene overall, comparing to the overall healthcare system, but they are working in the laboratory, collaborating with the dental clinician to transfer his treatment plan, his vision with the expectation of the patient into reality by fabricating crowns, bridges, implants, and full arch prostheses.
So, in what ways does the dental laboratory, contribute to treatment planning rather than only executing the dentist prescription?
Although we know, the dental clinician holds the legal responsibility in diagnosing and final treatment planning, the dental technician also contributes in the treatment planning through his experience, technical experience, and in the laboratory's procedure.
We can see now on the monitor that you're using computers also nowadays.
Yes, we are.
Yeah. So, you were saying?
We're contributing in the design and the fabrication of the prostheses. They can identify any risk for the future prostheses as well. So
how does a laboratory work directly influence clinical outcomes and long-term patient satisfaction?
Dental technician will evaluate each cases presenting to the laboratory. Each dental technician has the responsibility to check and evaluate the cases before starting any procedure. So they assist in determining if there is margin clearance, adequate tooth preparation, adequate occlusal reduction. Sometimes in some cases we need the path of insertion for multiple unit bridges. The angulation of the implant cases, if the technician, if limitation is identified and there is a chance of any risk of a fracture, misfit or misfit errors, and poor aesthetics of the case, the laboratory will suggest alternative solution to the case.
Nice. So now you see how this is how it really becomes essential and it really developed. After these years, the laboratory suggests solutions to the doctor.
Yes.
And that's very important. And definitely, I've seen, as I mentioned earlier, that we saw on the monitor. Nowadays, you guys were using computers and softwares.
Yes.
So to design?
Yes, this is the new technology. We use CAD/CAM, which is computer aid design, computer aid.
The program called CAD/CAM.
CAD/CAM, which is specified to computerized aid design and manufacture.
So, let's say I'm a patient. How would you use that computer in my case, for example? I need a crown or, crown.
Yeah, when we receive the impression from the doctors, either way.
You receive a picture?
Not the picture, no. We receive the patient, the doctor will take the impression in the patient mouth and send it to the laboratory.
The X-ray, you mean?
Not the X-ray. Like when you take impression for any case.
Oh, the impression you mean with the clay?
Yes.
Okay, you put the clay in your mouth and then you take all the jaw.
Yeah, so we get a study model or working model.
So you call it impression?
Yes.
Ah, that's a new word.
Okay. When they send it to the lab, we pour the impression and we get working models.
Yeah.
These working models, we scan it through the CAD/CAM machine. When we scan, we can identify each case.
You scan 3D, definitely.
Yes. 3D, so it goes through a process, scanning, then milling, then we put it in the centering furnace.
Wow.
We receive the case ready-made.
So it's like printing 3D.
Yes.
Nice. That's definitely something.
This is the new technology in our field.
Nice. So there is no misfit. There's no, I mean, the margin of error is very minimal. Am I correct?
Yeah, but in some cases, it depends on the technician to check there is a margin, a clearance sufficient for each cases.
Okay.
So it depends on the between the.
And nowadays, I think it takes less time than the old days.
Yeah, the steps, it depends on the step of each cases. We're still working with, we have two types of restoration, either with BFM, which is porcelain fused to metal, which is different techniques, and the zirconia we are using in the lab, which is through the CAD/CAM machine.
Yeah, I wanted to ask you about something, but I forgot, Ms. Amna. Now, definitely, all depends on the impression, on that clay, let's call it, okay? The impression you call it. All depends. Even if you do an X-ray, even if you take a picture, even if I describe with the report as a doctor, still the impression is the most precise measurement.
Yeah, so everything is depend on the sufficient impression taken by the doctors.
That's why they say he puts all these things, the blue clay, Yeah. So definitely, it's a milestone in laboratory. So what accountability frameworks govern the work of dental laboratories, particularly in relation to patient safety and clinical accuracy?
Dental laboratory operates under the dental administration, and there are some subdivision with the administration, including clinical accuracy, infection control, and the infection control and ethical practice and patient safety, which determines and set certain protocols for the work in the lab.
Is there, I mean, when selecting restorative materials, what clinical and laboratory factors must be prioritized to ensure optimal outcomes?
Okay, there are some factors to be considered here. First of all, biocompatibility, material strength, aesthetics, some factors other than wear compatibility with the opposing dentition and the longevity of the occlusal load.
So, okay, I want to ask you something out of those veneers, and there is the other thing. What's it called?
We have crowns, bridges, implants, veneers.
Yeah, but there is also something like veneers, but has another name. Anyway, how long they stay?
It depends on the. There's many factors affecting the longevity of the.
The longevity.
Yeah, it depends from the preparation of the doctors, the materials used for cementing.
Cementing, let's say this is the substance that attaches the veneer to
the oral health of the patient affect if the patient keep using the flossing and toothbrushing and keep the
teeth clean.
Yes, it will be last long for many years.
Really?
Yes.
Wow, that's amazing. I see a lot of Kuwaiti doctors are very, very smart in that, honestly.
Yeah, there is, alhamdulillah.
Yeah, that's definitely amazing. One has to be proud.
Yes.
So, how do you evaluate the balance between biocompatibility and durability and aesthetics. When choosing materials such as zirconia or ceramic systems?
Okay, first of all, biocompatibility, we can say both.
Wait, before that, I mean, we have materials, right?
Yes.
Can you tell us what are the name of these materials that, you know, we attach to our teeth? Like, for example, in case of a crown or bridge or veneers and
yeah, we have what we are using in the laboratory right now. We have the ceramic. Some cases with we call it porcelain fused to metal, BFM restorations. The other materials is zirconia.
Zirconia.
Zirconia. So we can differentiate between these materials. It depends on the biocompatibility, the aesthetics, the.
I mean, which one's better?
There is difference. We can't say which one is better. Each one has different substructures that it can be used for either way. So biocompatibility, both zirconia and ceramic system are highly biocompatible, but in some cases, rare cases, the patient might have sensitivity to metal, as I said, with the BFM, metal with ceramic. But both materials are highly biocompatible. There is no.
Zirconia comes from what? Okay, porcelain, we know what is it. But zirconia, what is it?
It's the material.
It's the material.
Yeah,
it's called zirconia. Is it similar to ceramic?
No difference. So with the about the material itself, the durability of zirconia is the durability. The zirconia have higher strength than ceramic system, which make it ideal for posterior and long span restoration. Other than aesthetically, ceramic is more translucent than zirconia, which is make it ideal for anterior aesthetics region. So now
for a beautiful smile, use ceramic.
You can say this is the difference between these materials. But recently, with the newer multi-layer and the translucent zirconia, this is a new discovery with the blanks of zirconia. The aesthetics of zirconia is improved, and we can use it also in anterior region.
Okay, so we go for zirconia.
This is what we are using most in the laboratory.
Longevity, you know, that's why. Because I don't want to put something or a veneer or a crown to my. I want them to look natural, and yet they are clean and white. Definitely has Hollywood.
And you can see the different shades of the teeth, like a natural tooth.
Exactly, and that makes it like, you know, really Hollywood smile. So, what role does you know, quality assurance play in minimizing remakes and clinical complications?
If a quality assurance is strictly embedded within the with the dental laboratory process of the workflow, the remake cases is significantly minimized. So we can reduce the cases of avoiding mismatch colors of the cases, or avoiding a fracture, avoiding margin shortage. So this is more.
I want to ask you a quick question because we are, you know, at the end of our interview. What are the challenges?
There are some challenges within the dental laboratory procedure. Sometimes there are very increase in the volume of the cases, which makes the technician try his best to maintain the application of the protocols we have in the laboratory, sometimes with the verification check. That's why the submission of the cases. So it's like a teamwork in the dental laboratory. Each technician has specific tasks to make and procedure to proceed to finish the cases in the lab.
Ms. Amna Ashkanani, any last message for the viewers?
We have a lot of nowadays we have and in the coming years we have more advanced digital technology and more innovation in our field. So I encourage dental technician to have more, to seek more knowledge and improve their skills, especially with the our field, by attending more conferences for dental technology technicians and more hands-on workshop to improve our field.
And they need some higher wages, I guess.
Yes. Thank you
so very much, Amna
Thank you
Ashkanani.
so much for the invitation.
Dear viewers, that was our guest, Amna Ashkanani, dental laboratory specialist in Al Farwaniya Specialty Dental Center. And definitely we'll move on. Dear viewers, the idea may sound strange to some, but snail secretions have become one of the most prominent ingredients in the skincare world. This natural ingredient is rich in elements that help hydrate the skin, regenerate cells, and improving skin texture, and it is widely used in modern cosmetic products. That's what we will explore in the following report on cosmetics made from snail secretions.